Welcome to ScrubNotes, What to Say in Clinical Encounters. Whether you're heading into an OSCE, starting rotations, or just trying to feel less awkward talking to patients, this podcast is here to help you sound more organized, more confident, and more natural with patients without memorizing long scripts. I'm Kate, a medical student, and I break down simple, repeatable frameworks so you know exactly what to say in real clinical situations. Each episode is short, practical, and focused on one specific skill, with examples of what to actually say in real encounters so you can use it right away. All right, let's get into today's skill. One of the most challenging moments in a clinical encounter is explaining what you think is going on. You've gathered the history, you've done your exams, you have a differential in your head, but then you pause to think, how do I actually say this out loud? So you either sound unsure, over-explain and ramble, or avoid explaining your thinking altogether. And even if your clinical reasoning is solid, if it doesn't come out clearly, it could sound like you're not confident. So today, we'll work on fixing that. Most students know how to build a differential diagnosis. That's not the issue here. The issue is how to communicate it in a way that feels clear, structured, and reassuring to the patient. So what happens if you don't? Well, you might list too many possibilities, use too much medical jargon, or your explanation feels disorganized, or you start second-guessing yourself mid-sentence and your confidence drops as you speak. What we want to do instead is have a clear explanation that shows clinical reasoning without overwhelming or worrying the patient. This is where our Connect framework comes in again. In the last episode, we talked about how to introduce a physical exam using context, navigate, ease, confirm, and tie together, because that helped you transition smoothly into the exam. So now we're applying that same structure, but to how you explain your thinking after the exam, because explaining your differential isn't about listing diagnoses, it's about guiding the patient through your reasoning. So today we'll focus on context, narrow, ease, and confirm. Think of this as a transition from gathering information to making sense of it all. Let's break this into a simple, repeatable structure. Step 1 is to give context. So you want to set up your explanation. Before jumping into diagnoses, tell the patient what you're about to do. Here's an example soundbite. Based on what you've told me and what I've found so far, or I'd like to go over what might be causing your symptoms. This signals that you're shifting into explanation mode. So why does this work? Well, it prepares the patient, shows you're organized, and makes you sound intentional. Step 2 is to narrow. This is where you're going to give your likely top 2 or 3 differentials. So now present your differential, but keep it focused. This is where many students go wrong and they start listing everything. Instead, you want to give 2 to 3 likely possibilities and prioritize the most relevant. For example, one possibility is muscle strain, especially since the pain started after activity. Another possibility could be inflammation in the area. You get the idea. Notice you're not saying, I don't know. You're saying, here's what we're considering. This shows clinical reasoning without sounding uncertain. And in an OSCE situation, this also shows you're avoiding premature closure bias. Step 3, use simple, patient-friendly language. So this is not where we want to use all of our fancy $10 medical words. We want to avoid that jargon. Instead of saying gastroesophageal reflux, say acid reflux. Instead of saying myocardial ischemia, say reduced blood flow to the heart. The goal isn't to sound impressive, it's just to be understood. A good rule of thumb for you is if a patient wouldn't use that word, then you probably shouldn't either, and just use a simpler term. Step 4 in our framework is ease. This is where you want to reassure the patient without overpromising. This will help them feel more grounded. Here's some sound bites for you. The good news is, or most of the causes we're considering are manageable. This is especially important if your differential includes something serious. You're not dismissing concern, you're providing balance. This helps reduce anxiety, builds trust, and keeps the conversation calm. Step 5 in our framework is confirm. This is where you're going to check the patient's understanding. So don't just talk to them, make sure they're with you and following along. The soundbite might be, does that make sense? Do you have any questions for me about that? This turns the explanation into a conversation and not a monologue. So let's hear what that all sounds like when we put everything together. Notice there's hopefully more clarity and not complexity in this example. Based on what you've told me and what I found so far, there are a couple possible causes for your symptoms. One possibility is acid reflux, which can cause that burning sensation you described. Another possibility could be irritation in the esophagus. Good news is that these are usually manageable. Does that make sense? What questions do you have for me? So notice there was no jargon and no uncertainty, just context, narrow, ease, and confirm. And that takes, less than 20 seconds? Let's review some common mistakes so you can hopefully avoid them. Number 1 is listing too many diagnoses. This overwhelms the patient and makes you sound unsure. Stick to your top 2 or 3. Number 2 is using too much medical jargon. If the patient doesn't understand, this really doesn't help anything. Number 3 is sounding uncertain. Try to avoid phrases like, I'm not really sure, it could be anything. Even if you're still thinking, frame it as a working plan. This can be a major differentiator in an OSCE's exam, because when you do that well, it shows clinical reasoning, organization, and patient-centered communication. Remember, examiners aren't just grading what you think, they're grading how clearly you can explain it. And it shows you can synthesize information, communicate it clearly, and guide the patient forward. If you remember one thing from this episode, I hope you take away context, narrow, ease, and confirm. You don't need perfect wording, you just need structure. And once you have that clear structure, your confidence naturally improves. In the next episode, we're going to talk about how to ask sensitive questions in a way that feels professional, natural, and not awkward, because that's another moment where students often hesitate. And just like today, we'll use the same CONNECT framework to make it simple and repeatable. If this helped you feel more confident explaining your thinking, you're building one of the most important clinical skills. That's it for today's episode. Great job showing up and putting in the reps. Whether this felt easy or a little uncomfortable, that's exactly where growth happens. This isn't about memorizing scripts, it's about building a system. If you found this helpful, take a second to follow or share it with a classmate. Let's make clinical communication a little less stressful for everyone. Thanks for listening, and keep practicing. You got this, future doc.